Hey guys, how are you all doing today? It's such a pleasure to be back on the program. My name is Edith. I am so excited to see you all. At least to know that you're still there and watching me today. So, my name is Edith, and I've been away for about 3 weeks. Not necessarily because I didn't want to do this, but because October is Breast Cancer Awareness Month, and I thought it would be great to have at least a guest on the program. I did get in touch with a few people, but due to COVID and all the social distancing, and as a matter of fact, one of my guests just tested positive for COVID. Yeah, so it kind of was very challenging getting her across. I mean, I wouldn't want to go close, even though I already had COVID, but I see people being reinfected, after the first time. So, well, I'm going to be doing this by myself today. Thank you so much for joining me. It's Breast Cancer Awareness Month, and it is my pleasure to bring to you today every information you need to know about breast cancer prevention, breast cancer management, and how to actually live through it. So first of all, I want to acknowledge the struggles of my Nigerian brothers and sisters back home who have, had to fight for their rights and have had to, fight for the basic things that, they deserve as human beings. My heart really goes out to all of you. And I want you to know that even though, I may not be there physically, but I'm with you in spirit. And I am praying so hard and hoping that someday we will get the change that we deserve, and we will make our country, Nigeria, what it is supposed to be, an envy of all the other nations of the world. Because really, we have everything we need. We have the human capacity. We have every form of. We have the resources. We have the intelligence. Nigeria is a great country. I believe in that country so much, and I know that we are definitely going to come to a point where, where we're really supposed to be. So please, while we're agitating, while we're, requesting the basic things that we need, I want us to, apply caution and protect ourselves. Let's apply a decent amount of caution. So thank you so much to all of you who have fought through, who have, come out to support the EndSARS protest. Thank you all. You have done a tremendous job. You have left a mark that will never be forgotten anytime soon. So just to go back to what we have for today, I'll be talking about breast cancer and a few things around breast cancer that I think we all definitely need to know. As an oncology nurse, I work with cancer patients. I have seen so much. My heart bleeds every time. And knowing that these things are things that some of these things are things that could actually be prevented, it even makes my heart bleed the more. I get really worried, and I get really emotional when I see people being diagnosed with, disease processes that could have been prevented or could have been caught early, or, something could have been done. And breast cancer is definitely one of those cancers that can be prevented, at least to a reasonable extent. And that's the reason I am taking my time to actually bring this program to us before the month of October ends. And hopefully someone out there will find this beneficial enough to actually go out and do something. So first of all, I want to talk about breast pain. I've heard a few people ask me about, I have pain here and I have pain there. I have pain in my breast. Does it mean I have breast cancer? It doesn't necessarily mean that you have breast cancer when you have breast pain. And usually, 9 out of 10 times, breast cancer, the early stage of breast cancer is painless. People who have, shown to have breast cancer, rarely reported any kind of pain. So breast pain is usually not something that you would worry so much about, but of course, if it starts to bother you to the point where it becomes really, really inevitable that you have to see a doctor, then you need to go see a doctor. So most times, puberty could be a cause of breast pain. If a girl is just growing breasts, if a boy is just growing breasts, they could be having breast pain. Another thing that could be responsible for breast pain is menstruation. So a few days before a woman has her period, most women have reported to have breast pain. Most women feel breast pain, breast tenderness. The breast feels a little heavier, and all of that. And then pregnancy can also result in breast pain. Another thing that could result in breast pain are certain medications. The potassium-sparing diuretics, some psychiatric medications can also cause breast pain. So, but if you're not sure what it is, I think it will be very, very important that you at least try to see a healthcare provider before it becomes something that, it could be really dangerous. So, what causes breast pain? I already talked about that. And then we have something called a breast cyst. Cysts are usually benign, meaning they're non-cancerous, they do not travel. Sometimes we have people with abscesses. Breast abscesses could be growing inside of the breast. Yeah, so some women have something called a fibrocystic breast changes. So if you feel your breast and you feel this kind of rubbery it's not, I wouldn't say like a solid, it's kind of rubbery. It's not firm, it's movable. If it's not firm and it's movable, then chances are it is not breast cancer. But of course, if you feel something hard and firm and not movable, then I would want you to go see your healthcare provider. Now, when is breast pain associated with breast cancer? Now, there are so many symptoms of breast cancer that I'm going to be discussing with you. But again, the goal of this program and my goal is to ensure that I educate everyone to prevent any disease that can actually be prevented. So with things like cancer, when cancer begins to be symptomatic, chances are it has really, really progressed. Okay, so when you start feeling all the symptoms of cancer, then at that point, there may be cancer that has really grown past where it started from, which is called metastasis. So it's very important that you know how to check your breast. It's very important that you at least get to know your body. It's important that you get to at least be familiar with your breast. If not for any other thing, look at yourself, look at your breast. Be you a woman or a man, take time to look at yourself and make sure that, you identify, you're able to identify changes when they occur. Now, I already talked about medications that can cause breast cancer. The next thing that I'm going to talk about are signs and symptoms of breast cancer that I think is very important for you to know. Now, if you start feeling or you see any of these signs and symptoms, I really, really urge you. I mean, I have seen things happen. A couple of years ago, a woman came to the hospital and she had a mammogram because she had a lump in her breast. And the mammogram showed that she had, a cancerous lump in her breast. And instead of going to take the lump out or get a mastectomy, a mastectomy is a removal of the breast tissue. So instead of going to seek medical help, she went to the church. And I'm not saying it's wrong to pray. I'm not saying it's wrong to be religious. I'm not saying it's wrong to have faith that God can heal you. But medicine has shown that when you seek help, when you go to the right for the right medical care, you can get well. So she didn't go to the doctor's office. She didn't go back. She rather went praying. And then in about a year or so, the cancer had metastasized all over and it had crossed to the second breast. And guess what? That lady is dead as I speak with you right now. So I want us to take this very seriously. I am very passionate about this. I'm very, very passionate about it. And the reason is because I have worked with people who have had breast cancer, who have breast cancer, and I have also worked with people who have survived breast cancer. So it's not something for you to be so afraid of, but hey, if you have to, take the necessary steps to preventing early death, then you need to do that as soon as possible. Now, what are the signs and symptoms of breast cancer? First of all, if you start noticing any lump in your breast, and that is why I had talked about you knowing your breast. If you know your breast, there is no, you've always known that you don't have a lump in your breast, and then all of a sudden, gradually, you find out that there is this lump that is gradually growing in size. It's firm, it's hard, and then it's not movable, it doesn't hurt, that means it's not painful, then you need to go see your doctor. Now, if you also notice something called dimpling, if you know dimples, like, people who have dimples on their cheeks, and now you find a dimple on your breast. You've never had a dimpled breast, and then all of a sudden you find a dimple on your breast, then that is something for you to be really, really concerned about. Also, there is something called peau d'orange. If your breast comes out looking like the orange skin, the skin of the orange, yes, you need to go see a doctor. That is a sign of breast cancer. If you ever also begin to notice discharge, you're not breastfeeding, certain contraceptives can make you have breast discharge. But if you're not breastfeeding, and you're not pregnant, you really shouldn't be having, especially bloody discharge. If you start noticing any kind of red bloody discharge from your breast, from your nipples, then it is time for you to go see a doctor as soon as possible. If you also begin to notice that one of your breasts begins to be bigger, like way bigger than the other one, of course, our human parts are not the same size. Even as I speak with you, most of us do not have the same, most of our breasts are not the same. The left and the right are usually not the same. But then if you start noticing that one of your breasts begins to be obviously bigger than the other one, then you need to go see a doctor as soon as possible. If you start noticing any redness around your breast, any warmth, meaning your breast begins to feel hot to touch, I think you need to go see a doctor. Now, what puts an individual at risk for breast cancer? There are so many things that can put an individual at risk for breast cancer. One of them, there are two categories. The first are the modifiable, which are the things that you can change, and the others are the non-modifiable. So the non-modifiable risk factors are like the age. With older women, older women seem to have breast cancer more. People who have a family history of breast cancer. So if you have a first-degree relative, your mother, your sister, had breast cancer, then chances are you could be at risk for breast cancer. Then there are so many other things that could be responsible. Well, being a woman, could place you at risk for breast cancer. You cannot change your gender or your sex. Now, I'm going to talk about modifiable risk factors, but then if you know that you have a family history of cancer, any kind of cancer, it doesn't have to be breast cancer. I would say any kind of cancer. If you had a father who had prostate cancer, an uncle, an aunt, a grandparent who had any kind of cancer, colon cancer, whatever, you need to start going to see your doctor for preventive medicine. So you need to go get yourself screened. It is recommended that women from 40 years old go get annual mammograms for breast cancer screening. And then if you have a risk factor, if you have a first degree relative and all of that, it is usually advised that you go earlier, and the goal is just to catch the cancer before it begins to spread. Now, early detection is the key. According to the American Cancer Society, when breast cancer is detected early and is in the localized stage, the 5-year relative survival rate is 99%. So it is almost 100%. So if you are able to detect breast cancer in the early age or stage, there is a higher percentage of survival. But the problem we have is that a lot of women do not even care. They do not even go to the doctor's office. It's so alarming, but that's the reason I'm bringing this program to us today. Early detection is key to breast cancer prevention and management. Now, you might not be able to cure breast cancer completely. You could have a mastectomy, which is a surgery to cut off the breast tissue and all of that. But early detection will save you all of that headache. Now, how do you check for breast cancer? Okay, so before I go into that, I'm going to talk about the modifiable risk factors so I don't forget about it. Modifiable risk factors for breast cancer include, inactivity, physical inactivity. So if you don't exercise, there are chances that you could, be at risk for breast cancer. If you smoke, if you drink too much of alcohol, if you've never had a child, if you are on some kind of contraceptives, birth control pills, injectables, if you are post-menopausal, meaning that if you've passed the menopausal stage, which is like from 50, 55 years old, and you're taking some hormonal replacement therapy, then you might be at risk for breast cancer. Now, how do you check yourself for breast cancer? You check. It is advised that every young woman checks her breast at least every month. So once a month after your period, check your breast. It's very easy. With the three fingers, you want to check your breast. Standing in front of a mirror, put your hand behind your head and just go in a circular motion. Try to feel from your armpit all the way to the breast and then to the nipples. You want to check for any hard lump. You want to check for any kind of cyst or anything that is kind of outstanding or something that kind of strikes you and, in a very wrong way. So you check your breast every month. You do that standing in front of the mirror. You could also stand, place your hands on your hip, look at your breast, and then place your hands behind your head. And then you can lay down and also do the same. But again, the goal is prevention. The goal is prevention. And you cannot prevent what you don't know. You have to know what exactly your breasts look like. So I already talked about signs and symptoms of breast cancer and how you can actually identify that you have breast cancer. Now, when you are diagnosed with breast cancer, there are different stages of breast cancer from stage 1 to about 4. And the one with the best prognosis, meaning the ones with the best outcomes, are the ones that are still in situ, meaning that they are still in the spot where they started from. And that is why early detection is very important. If you don't find them out before they travel or they metastasize, the prognosis or the outcome could be very, very poor. So early detection is very important. If you are a woman over 40 years old, I strongly recommend that you go get your breast examined, do a mammogram. And if you are below 40 years old and you're finding all these changes that I talked about on your breast, you need to go see a doctor as soon as possible. So I urge every woman out there, every man, and of course men do have breast cancer also. So it's not a gender specific thing, but we have more women having breast cancer than men. So if you are out there and you've noticed any of these signs and symptoms, please, I need you to go as soon as possible to the nearest medical center, go see a doctor, go get examined and start the treatment process. There are so many treatment options for breast cancer: radiation, chemotherapy, surgery, and all of that. So the earlier you find out what is going on with you, the better. Breast cancer can actually be prevented if we act early and if we take our health really seriously. Thank you all so much for watching this program. I look forward to meeting you again. I'm going to try to keep this coming, but it might not be every Sunday like I used to because of time constraint and a whole lot of other things that I'm handling right now. But I promise you, I will make sure that I continue to bring us this program because I had a lot of people coming and asking me, Edith, are you okay? Is everything all right? Yes, everything is fine. And thank you all for checking up on me. Thank you to those of you who took time to call and send me messages. I am very fine. And I hope this message gets into the ears of the right people and brings about the much needed change. Thank you so much. And until I see you again, have a blessed weekend. Bye-bye.